Can heart disease be prevented? Indeed, in many instances, you can take steps to prevent heart disease or slow down its advancement. Heart disease encompasses various conditions affecting the function or structure of the heart, with coronary artery disease or CAD being the most prevalent form. CAD involves the accumulation of plaque in the coronary arteries, which supply oxygen-rich blood to the heart. This buildup can restrict or block blood flow, resulting in symptoms like stable angina or, in severe cases, a heart attack. While it's not always feasible to entirely prevent plaque buildup in the arteries, the process known as atherosclerosis typically begins during childhood or adolescence. However, you can potentially slow its progression to avoid or postpone complications. The initial step involves understanding the risk factors associated with heart disease and then taking proactive measures to mitigate those risks. What factors contribute to heart disease risk? Several risk factors exist, some beyond your control and others influenced by lifestyle choices. These risks are generally consistent across sexes, yet individuals assigned female at birth or AFAB may face unique risks compared to those assigned male at birth or AMAB. Non-modifiable risk factors such as age, family history of heart disease, menopause, and race or ethnicity cannot be altered. Aging increases heart disease risk, with a significant portion of those affected being 65 or older. A family history of heart disease, especially if diagnosed prematurely, elevates risk. Menopause introduces added risk for AFAB individuals, and race or ethnic background may contribute to cardiovascular disparities. Although non-modifiable factors persist, focusing on lifestyle-related risks becomes crucial. Lifestyle changes, even small ones, can significantly impact overall risk. Number 1. Alcohol consumption. Excessive drinking, defined as more than 1 daily drink for AFAB and more than 2 for AMAB. Number 2. Diet. An unhealthy diet featuring high sodium, saturated fat, trans fat, and sugar intake. Number 3. Physical activity. Inadequate exercise, with healthcare recommendations suggesting at least 150 minutes of moderate intensity exercise weekly. Number 4. Tobacco and nicotine use. Smoking, vaping, or using tobacco and nicotine products. Number 5. Recreational drug use, involvement with drugs like marijuana, cocaine, and amphetamines. Consult with your healthcare provider to explore manageable adjustments that accumulate positively over time. How do I safeguard against heart disease? Preventing heart disease is often achievable through natural lifestyle adjustments, although in some instances, your healthcare provider may suggest medications or other interventions. Implementing the following lifestyle changes can significantly contribute to preventing or delaying heart disease. Number 1. Tobacco avoidance. Steering clear of smoking, vaping, or using other tobacco products is crucial. Tobacco use is a major preventable risk factor for heart disease and stroke. Smokers face over twice the risk of a heart attack compared to non-smokers, and even minimal daily smoking substantially elevates the risk. Quitting, though challenging, is a vital step. Consult your healthcare provider for assistance and explore community resources and support groups. Number 2. Moderate alcohol intake. Excessive alcohol consumption can lead to heart and blood vessel issues, including atrial fibrillation, heart failure, high blood pressure, and stroke. If you choose to drink, adhere to recommended limits: no more than 2 drinks per day for those assigned male at birth and no more than 1 for those assigned female at birth. Number 3. Heart-healthy diet. Opting for a heart-healthy diet supports optimal cardiovascular function. This diet provides essential nutrients while restricting substances that can elevate blood pressure, cause artery blockages, or lead to other problems. Add to your diet foods rich in omega-3 fatty acids, fresh fruits and vegetables, healthy oils like extra virgin olive oil, and whole grains. Reduce or get rid of processed foods like pre-packaged meals and fast foods. Reduce sodium intake. Take the salt shaker off your table. Avoid adding salt when you cook. Look for low-sodium versions of your favorite products. Additionally, reduce your sugar intake. Many fat-free foods seem healthier but are high in sugar. Read labels and opt for sugar-free desserts or fresh fruit. Minimize the less healthy oils like palm oil or coconut oil. Consulting with a dietitian can be beneficial if you're considering dietary changes. They can assess your current eating habits and recommend immediate adjustments. Number 4. Managing lipid levels, including total cholesterol, LDL or bad cholesterol, and triglycerides. Elevated LDL cholesterol contributes to arterial plaque, increasing the risk of atherosclerosis and heart disease. Regular blood tests, like a lipid panel, can assess these levels. Ideal targets include total cholesterol below 200 mg per deciliter, LDL cholesterol below 70 mg per deciliter for those with cardiovascular disease, and below 130 mg per deciliter for others. Number 5. Boosting HDL or good cholesterol is essential, aiming for levels above 60 for optimal heart disease protection. Effectively managing blood pressure, targeting 120/80 or lower, is vital to reduce the risk of heart-related complications. Number 6. Individuals with diabetes face heightened heart disease risks due to associated conditions like high blood pressure and cholesterol. Number 7. Maintaining a healthy weight is pivotal considering its impact on blood pressure, cholesterol, and diabetes risk. Measurements such as BMI and waist circumference help evaluate weight status with recommended targets based on individual factors. Number 8. Regular physical activity significantly contributes to heart disease prevention by enhancing heart function and managing risk factors. Adults should aim for at least 30 minutes of moderate intensity exercise 5 days a week. Incorporating movement into daily routines, such as stretching or walking breaks, supports overall cardiovascular health. Before implementing significant lifestyle changes, it's advisable to consult with a healthcare provider to ensure safety and tailor recommendations to individual needs and conditions. Gradual increases in activity levels are generally recommended. Is heart disease reversible or curable? Unfortunately, once you develop coronary artery disease, it cannot be reversed, and there's no cure available. However, lifestyle modifications and medications can slow down or halt its progression. Ongoing research explores new medications and therapies, offering hope for the future. While prevention is paramount, treatment becomes essential when prevention reaches its limits. Despite efforts to prevent heart disease, some risk factors are immutable, and individuals may encounter barriers such as time constraints or limited resources. It's crucial to prioritize prevention efforts while acknowledging the availability of treatment options if needed. Cleveland Clinic emphasizes the empowerment in knowing that heart disease can be prevented or delayed. However, if prevention measures yield unsatisfactory results, individuals should refrain from self-blame. Instead, they should communicate with their healthcare providers to explore alternative strategies and consider the role of non-modifiable risk factors. Medications may offer additional support in bridging the gap between prevention efforts and desired outcomes. We hope you found this video helpful. Don't forget to like and subscribe to our channel for more content on health issues. Thank you for watching.